Chile took 40 years of consistent policies in nutrition to decrease this 37% chronic malnutrition to less than 1%, with better conditions of their health system, with better condition of education of the people. I also think that out of this crisis, we really can make possible things to happen. I've been trying to put some of this idea of getting a healthy start. What do we have in Guatemala now that will help us? We have a legal framework, and I want to acknowledge the presence of Andres Botran seated back there. He was the past Secretary of Food and Nutrition, and during his tenure, the law of food nutrition was passed, the policy was adopted, the regulations, and all this needs to help us. But we need really to be consistent. One decision that we made prior to taking my tenure in the Secretariat was that we will continue with minor changes the program that he developed for the reduction of chronic malnutrition. And what we need that this integrated program continues for the next government, and the next government, because we cannot change every 4 years and just reinvent the wheel.
We have this very good approach for fortification. And the issue is, from the policy point of view, is delivery. How can you have this fortified food going to the target population for the rural, for the poor? Because they never get those things in the rural area. So how can you get this food delivered to the target population? We have this collaboration, public-private collaboration, because fortified food, you need the industry. If we have the fortified food produced by the industry, and the government, public sector will help in the social marketing and create the people to have the demand of such food, then the industry can going on to produce that. So the partnership between private and public collaboration is really very critical for get the food fortification project effective. Otherwise, it's never work, because our rural people, they are not going to buy it if they don't have this idea of taking those good food for their children.
In order to solve this kind of nutrition problems, that we have to really take account cultural issues here. Even in every family, different culture, and in every nation, they have different culture. But because of globalization, it became more complicated at this moment.
Nutrition and food policy is probably the most complicated policy arena that I have ever encountered. Because, I mean, if you look at our evils for non-communicable diseases, when it comes to tobacco, it's a very straightforward decision. Even one puff is deleterious, so you just increase taxes, forbid advertising. There's a very clear policy prescription package, because it's a clear evil that is bad no matter what, even at low doses. You move to alcohol, things start getting a little bit more complicated, because at lower levels it's not really harmful. It may even be beneficial. It has a social function. But when you get to food, it's essential for sustaining life. And you can't have clear, easy, one-size-fits-all policies. In fact, and it's all associated also with cultural issues, with patriotism. A big part of the current food crisis has been caused by erroneous policies from governments, like export prohibitions, like some of the subsidies for use of corn and other staples for biofuels. It's been wrong policies, particularly the response to the acute, the idea of not every man for himself, but every nation for itself, the breakdown of multilateralism and cooperative arrangements that has created a lot of the price pressures and net importers of food are suffering a lot because of bad policies. So I just think we're facing one of the most complex policy arenas because of all the implications, and the need for balanced approaches, therefore, is very important.
There are many examples of collaboration outside the current players that have dominated. The issue is about scalability. How do we scale this up to deal with the calamity that faces us today in the world? That we had this perfect storm developing that has now placed the issue of malnutrition more centrally on our agenda. So I think that it's important that we look in this conference at the way in which one can scale these models, replicate these models, and in a sense leverage in a whole range of new stakeholders, in particular communities. Now, if I look at the example of Bangladesh, which is probably one of the poorest countries in the world, the one thing that really surprised me is the statistics on infant mortality and maternal deaths are all on line to meet some of the MDG targets, much better than we are doing in South Africa. Why? Because they have strong organizations that have addressed not just the policy issue, but the delivery issues. Now, if you come back to the question of Ruth, there is a challenge that faces us today. And it's not just with the G8. It's not just with the leadership, political leadership of Africa. It's with all of us. And that's why it's a very important issue is who are the stakeholders that must mobilize public opinion and action on the issue of malnutrition? It can't just be nutritionists. It requires us to touch the private sector, to touch the ministers of finance, of agriculture, of trade, of the NGO communities, of civil society. So in a sense, we need to design a new architecture. Malnutrition is not a new issue.
No.
It's been with us for decades. Why haven't we succeeded in the past? Maybe we've been too concentrated into an incestuous community of organizations. How do we reach out to the decision makers? And that is the biggest challenge that faces us today, of taking malnutrition from a conference like this out into the streets, out into the parliaments, into the offices of the ministers of finance, into the offices of regional organizations, and obviously into the offices of the all-powerful G8.
We cannot blame complexity for inaction. And while it is very true that you don't want to take steps that lead to bad policies, taking no steps is not a policy either. And sometimes, as we've seen in many other areas of economic development, instead of trying to get our heads around absolutely everything, including all the science we don't know, we may have to put in motion many steps in parallel at the same time, because one feeds into the knowledge of another. And even if those steps are not complete and are not totally comprehensive, holistic, and well-designed, the steps need to be put very soon into action on all fronts. Complexity, again, of course the world is complex, but I would argue, as in all policy, that it doesn't matter where you start as long as the people that you are talking to understand that this has been taken at the highest level of attention and at the highest level of urgency. Our healthy start is not just efficiency. Our healthy start is also a great deal more of knowledge and of implementation. And government always has a role to play.